Well, MDS is it's basically an incurable disease. The only potential curative option is an allogeneic stem cell transplant, and that's a therapeutic option that comes with a high morbidity and mortality associated with it. So the vast majority of patients with MDS will ultimately die of MDS. And as opposed to some of the other diseases where there's a lot of excitement, such as melanoma, myeloma, and lung cancer, renal cancer, there's been very kind of few exciting drugs in the pipeline for MDS. The last few drugs approved for MDS with clinical data for MDS was about 4 or 5 years ago, and hasn't been really anything to fill that space. So there's a really kind of significant need for it in terms of the clinical responses. And also there's a large number of patients every year that are developing this disease, and also as patients receive more chemotherapy for their other cancers, MDS can also be associated with as a kind of a secondary effect from MDS. So the incidence is increasing over time as we get better treating other cancers. So there's a really significant clinical need for new therapies for this disease.